This is the final speech I will be doing for my comms class. It is a question of policy speech under the structure of Monroe's motivated sequence. And the topic is single-payer healthcare. GoFundMe, a fundraising website whose top three functions are memorial fundraising, charity fundraising, and most frequently, medical fundraising. Some common questions one may ask in response to this reality are, why do so many people have to revert to GoFundMe to pay the medical bills? And quite frankly, how is this even allowed to exist? The answer to both questions is rooted in the United States healthcare system. The solution, however, is not. My audience analysis revealed that 55% of the class knew of no other healthcare systems, while the remaining 45% knew of other systems. Some of the systems mentioned were the United States' own Medicare system, Canada's system, and universal healthcare in general. All of those systems are or closely resemble single-payer healthcare, the topic of this speech. Today, I will discuss the flaws of the current American healthcare system and explain what single-payer healthcare is, as well as describe what the U.S. would look like under a single-payer system. I hope that you will exit having learned about single-payer and its benefits. So, why does the U.S. system need replacing? Well, for one, it is expensive. The United States spends a substantially higher amount in comparison to other countries on healthcare. This graph illustrates that fact, as the United States spends nearly $10,000 per capita on healthcare, which is more than twice the average. In addition, the United States system is inefficient. The U.S. places last in overall efficiency and cost-related problems. Those numbers do not paint the picture of a system that is as world-leading as its cost. And lastly, the United States system is immoral. Medical bankruptcies are a consequence of the United States healthcare system. Hundreds of thousands of medical bankruptcies occur every year in the United States, specifically over 600,000. And as well, a 2009 Harvard medical study estimated that nearly 45,000 people died in the year 2005 due to lack of health insurance. While legislation has changed since, the United States still has upwards of 27 million people uninsured. So, now that we know about the irredeemable flaws of the U.S. system, what is the solution? Single-payer healthcare. What is single-payer healthcare? A single-payer system takes healthcare out of the private sector and makes it public and universal. Instead of paying into a private insurance plan, citizens fund a government-administered system by way of taxes, and costs are paid via a single payer, the government. All citizens have coverage for all medical services. And in addition, co-pays for doctor's visits and medicines also become affordable. For example, the United Kingdom, a single-payer system, average price for a prescription drug in the year 2012 was £7.65, or about $10. Also, single-payer systems are widely adopted in Europe and also in our neighboring country, Canada. Single-payer exists much closer than Europe or even Canada, however, as Medicare in the United States is a single-payer system. So essentially, single-payer healthcare is Medicare for all. Now that we know what single-payer is, we can explore what the United States would look like if it adopted such a system. For one, cost problems would be eliminated. This graph shows that countries that utilize single-payer pay far less than the United States. The UK, Australia, and Canada, for example, all have single-payer healthcare, while the rest of the countries on this list have a system that closely resembles single-payer. Also, while cost problems for the whole nation would be decreased, cost problems for individuals would also be eliminated, as they would no longer have to avoid doctor visits or medical care due to costs. In a 2015 study that analyzed the reasons why people avoid seeking medical care, it was found that 24.1% avoided due to costs and 8.3% avoided due to lack of health insurance. This issue does not exist under a single-payer system. In addition to those cost problems being eliminated, the introduction of a single-payer system would improve the economy. For one, the healthcare system becomes more efficient. Conveniently placed adjacent to the United States on this graph is the United Kingdom. The United Kingdom puts the U.S. to shame in nearly every category, ranking first overall, and more relevantly, first in efficiency. As I mentioned before, the UK is a single-payer system. In addition, single-payer helps small businesses. Under a single-payer system, businesses do not have to pay into employee insurance plans. This allows businesses the freedom to hire more, pay more, and participate more. It also removes the dilemma of large employers keeping workers under the 30 hours per week threshold, in which the employer would be mandated to then provide insurance. If the current system is an immoral system, then single-payer is the moral solution. Under a single-payer system, medical bankruptcies do not exist. The damaging effects that bankruptcies have on households will no longer be an issue. Numerically, a single-payer system will change that 600,000 bankruptcy number to a 0. And, as well, the idea of a private healthcare system is inherently immoral. A person purchases insurance to provide a financial solution to the medical bills they cannot afford to pay on their own. On the flip side, it is the goal of a for-profit company to turn a profit. In the realm of health insurance, companies profit by stripping customers of every piece of care they can possibly get away with. This pits average people who simply want to see a doctor or have a life-saving surgery against multi-billion-dollar corporations. Profit motive should not be involved in something as life and death as healthcare. So, what can you do? Single payer is a policy, so we have to go through politics. If you're registered to vote, then vote for candidates in your May 8th primary that support single payer healthcare. If you're not registered, then you can call or write to your representatives and tell them to sign on to either the Senate Medicare for All Act or the House of Representatives Medicare for All Act. And if you're wondering whether or not your representative supports single-payer healthcare, 2 of Indiana's 11 federal representatives support legislation for single-payer healthcare. One of which is Peter Visclosky, which represents District 1, which is up by Chicago, and the other is Andre Carson, who represents District 7, which is in the Indianapolis area. Which means, if you live in any other section of the state, these are your representatives, and none of them support single-payer healthcare legislation. And both Indiana senators do not currently support single-payer legislation. So, you have plenty of choices. In review, I discussed the flaws of the current U.S. system, described what single-payer healthcare is, and I described what the U.S. would look like under a single-payer system. Before I close, I would like to revisit the topic of patients reverting to GoFundMe to crowdfund their medical bills. It is morally unacceptable that people in the U.S. need to turn to GoFundMe as an insurer. Under a single-payer system, patients would not need to crowdfund their medical bills. It is my belief that healthcare should be guaranteed to all citizens in a country, especially in a country as wealthy as the United States. And under a single-payer system, that goal would be achieved.